had my surgical consult today with the endodontic for my gum graft surgery because I have one tooth that is out of a 1 to 4 scale is a 4, meaning that that's like, it needs to be fixed because obviously it's going to continue getting worse, and I'm having a risk here of losing that tooth at some point. But I clench my teeth a lot. I've always been like a really highly stressed person. I've always been kind of like a pressure cooker when it comes to stress. My dad is. And so I clench my teeth a lot. I clench them at night, but I did get a night guard last year with my dentist, and that has helped. I still wake up clenching sometimes, and I, throughout the day, notice that I'm clenching my teeth, so I have to stop. And that's a really big behavior change that needs to happen. The endodontic also told me that I brush my teeth too hard, so that damages my teeth. But she told me that she recommends an Oral-B and a 360 spinning brush that has a pressure indicator, so it tells you if you're brushing too hard, and I need to brush on this other setting to better protect my teeth. And she also told me that I have naturally thin gums, which makes it all much worse. And so I had braces twice because of FAP, I had extra teeth. And so they had to remove those teeth so that then I had braces on to bring my adult tooth down that was being blocked by these extra teeth. And then later, once I had my adult teeth in, then I was able to have braces again to straighten them. And so what happens, she said, and especially in my case, is that the braces, they naturally cause like your teeth to kind of jut out. Like, I'll show you. So like your hair, it looks much more prominent because I have thin gums, and there being the bottom of my bottom teeth are having some recession, whereas the top teeth are not so bad. But it's quite a protocol to do this. So for the gum grafts, I'm going to have the cadaver tissue, and they're going to graft it on there. They're going to give me biologics to help with to take. There's certain things that I cannot take during it that would affect it, my body accepting it and it grafting on. But 3 days before, I have to use this oral care recovery kit. It has a rinse, a spray, and a gel. I do that 3 times a day, and that's to kind of help get my mouth ready. So it'll be less painful, and it'll be better care for my graft too. And then I don't do that the day of surgery, but then I do that again the next day following surgery, and I do that for about 2 weeks. I'm not to brush where my graft is at all. And so I have to brush the rest of my mouth, like, so I'm not like doing like that, manipulating my mouth just to keep my mouth as still as possible. She told me not to smile if I can help, just not doing any manipulations with the mouth. Well, that's healing. I'll see her weekly, and then at 4 weeks, she will take out the cloth thread-like sutures, and I have to be on a liquid diet for 1 to 2 weeks. She said that I could maybe start having some soft foods that I don't chew, like midweek of that first week. And when I do chew anything at any point, like once I start chewing things, like it needs to be over here. Like I can't do it on this side. And obviously I don't want to swallow any food on this side either. And of course, things like seeds, things like that, I need to avoid because then that can get stuck. But then after the month, then I start having quarterly follow-ups for about that first year. And then she'll release me, assuming that it's all gone well. She did tell me that there are people that report that they've had a gum graft for like 25 years. So it can last a pretty good amount of time. And I only need the one right now. I'm hoping to be able to prevent the other ones, the other areas from getting worse. And so maybe I won't have to have any more after this. But, and then she'll they're going to give me an oral sedative. She said that works better than laughing gas. And I shouldn't need any IV sedation, at least. So she said to take off work that day and the day after to allow for the recovery and rest period. And and I'll ice every 15 minutes or so, especially that first day to help reduce the swelling. And so I scheduled that at the end of February, and I'm really glad that I did, because without even thinking about it, because I was thinking about doing it at the end of January, and I'm glad I didn't do that, because me and Mike's 4-year anniversary is mid-February, and we have a special dinner date and everything planned as part of our celebration, and I really want to enjoy that. So I'm not looking forward, though, to having just mainly liquids for a week or two. And she said the first day to do cold liquids for sure. So I'll get me some protein shakes and fun things like that. But I'm looking forward to getting this done with, because I know I've been needing to, and I talked about it with my dentist before, and this last year they checked my recession, and I'm like, okay, it's time. You really need to, especially since I am using a night guard now. I mean, I have for the last year, but I wasn't before that. So yeah, it'll be my 4th oral surgery, and in my experience, those haven't been so bad. So I'm hoping it won't be too terribly bad this time either. It's much more of a recovery process than I anticipated, but I think it'll be for the best. Keep you all updated. And so next week, after next Thursday, I have to stop. I can't have a lot of ginger or garlic, because I'm going to be prepping for my gum graft surgery the following Thursday. There's a whole list of things like you have to stop a week before if you're taking any of them or eating any of them, because they can interfere with your healing and the graft taking effectively. But the only thing on there is like garlic and ginger, and I'm a little weird because I can't really taste ginger. So, I mean, not ginger. I can't taste garlic. I love ginger. So I'm not going to be able to have my kombucha with the ginger in it. And I told Mike to lightly season the garlic, because I'm not going to be able to tell anyways if it's lightly or heavily seasoned. Yeah. But anyways, I'm feeling good about it. I definitely am looking forward to taking some time off work for just me, but that'll come later. I got to get through all this first and get filled up, and then I can take some days for me that are not medically related. Anyways, it's going good. Happy Rare Disease Day. I'm about to head out to get my gum graft surgery today, so I wanted to make a TikTok telling everybody Happy Rare Disease Day before I went under, and I don't know what I'm going to feel like after, so. No matter where you are, I had my 1-week follow-up for my gum graft surgery, and the doctor said that it's perfect. I got 100% because I was so anxious. I was like, did it move out of place? Did I do anything like wrong with the ice packs? She's like, you did 100%. I love my periodontist. Like, she is just amazing. Absolutely wonderful. Love her to pieces. She's so good. But anyways, so I had a great report, and so now I can have soft foods. So that means I can have things like including like fish and cooked vegetables, but I cannot have anything that has seeds in it. So, like I can't even have smoothies with certain fruits and things like that. So that's okay. But I can have seasonings. So as long as I stay away from nuts, nothing chewy. I can have alcohol now. She said if I wanted to. I can't have carbonated drinks yet, which is what I'm holding off for, which I have 1 more week for that, because I got a bunch of kombucha thinking I could have that as part of my liquid diet. So I am looking forward to my kombucha. But because I fasted from that for most of February so that I wouldn't, because I tend to overdo things that I really like to the point where I'm like, I don't like them much anymore. So I was like, I'm not going to drink kombucha very much at all this month. And that way I can have it during my liquid diet phase and everything. So anyway, I'm looking forward to that. It'll be a nice treat. I go back in another week for my second appointment checkup, and I have to chew only on my left side. I still can't touch or like look at or move my cheek. The surgical site, trying to not have facial expressions, which is really hard because I am a very smiley person, very expressive. So it's been really difficult. But for the most part, like the stitch no longer bothers me, like it settles, she said, and so it doesn't like poke me so much. It did poke me more today after I started eating some. But the last few days I didn't even notice it. And so it was hard to like, I'd like be like at work, like doing this, like, oh, I mean, I'm excited, but because it's just completely forgot. But anyways, so I'm really excited about all of it. Yeah, I've been mainly living off of Clamato juice the last 2 days. I actually drank 1.5 gallons of it because it just tasted so good. I got really tired of like the protein smoothies or shakes and then having smoothies. And so for breakfast on Sunday, I drank 1/2 gallon of tomato juice. That was my breakfast and my lunch. And then for dinner, Tuesday, I had 1/2 gallon of Clamato, and last night, 1 gallon. And that's really what I mainly been having, that. And then iced coffee each day. And then when I get hungry feeling, I would kind of have some protein shake or have some smoothie. I had 3 smoothies over the weekend. But that was mainly my liquid diet. That and tea. I had tea. But I just really, oh gosh, I never just drank Clamato juice before, and it tastes so good. It was so good. But I'm going to forgo that for a while now. I mean, I think I had plenty. So, but yeah, that's what's going on there so far. I think that's it. Yeah. So then, but at week 4, when I get the stitches out, I can chew on both sides of the mouth, and then I will should graduate to quarterly appointments until I'm released at about 1 year post surgery. So it's going pretty good. The procedure itself really wasn't bad at all. The way that she does it is the new technique, the modern technique. Because before they would cut your gum, like take the section out and then put the donor part in. So what she does is she just uses the same exact tool as they use when they clean your teeth, and she moves it away a little bit from your tooth and then slides in the donor tissue, and then she stitches it and pulls it around the tooth and stitches it again so it's nice and snug and everything. And so there's not any cutting, which makes so the pain's not an issue. I mean, yeah, it's tender, sure, but who doesn't have tenderness or muscle soreness to some extent? She prescribed 600 ibuprofen for it, which I didn't even need, but maybe 2 days, I think I took it. So, and then you can do Tylenol in between if you're still needing some extra, but it's not anything major. Especially not like how the old technique is that some old school periodontists still do, because they're not trained in the new one. But anyways, so that was really cool. And so I probably actually really didn't need a nitrous. I had to take 3 of the oral sedatives, because I was so anxious about what to expect that they weren't kicking in. But she said though, like the combination of the nitrous with the oral sedatives, is what works really, it works really well together, better than one by themselves. Cause she actually, when she said really like you have to have the oral sedatives, she was the nitrous wouldn't do anything really without it anyways. So if I just done nitrous, it wouldn't have been, helpful. So, but I think if I had to do it again, especially going to her, I don't think I would be able to be calm enough that the, sedative pills would be able to kick in, and I wouldn't override them with anxiety or fear of what to expect. So now I know that. And I wasn't really worried about it until I got there. And that's the thing, with PTSD is, right, is that you don't necessarily worry about things so much till you're in the situation again and it hits you and it all slams back in your face. And it's like, hey, remember when you were like this? Like, well, maybe that might happen again. Anyways, the OPSC, But, so hopefully I'll never have to do it again. But if I do, I think I can handle a lot better mentally going into it because it definitely wasn't as bad. Just like the COVID test wasn't as bad as I thought it was going to be. I'm completely freaked out at that. Had to be restrained. I didn't have to be restrained, at least for the gum graft. But anyways, so yeah, go back. And actually I go back. They didn't have any openings 1 week from now. So I go back that following Monday. So we'll see. Today, I went and saw the periodontist for my 2-week gum graft checkup, and she said everything's looking perfect. So I have 2 more weeks of soft food diet now, and still no seeds. Can't have any seeds, but I can have carbonated drinks now, so I can have kombucha. But yeah, so that's going good. The crying for 3 hours straight really hurt my gum graft, but she said it looked fine, and I still have a ton of those ibuprofens that she prescribed me. So I took one of those and slept because I was just exhausted Friday after all of that mess. But I think things are okay. And it's keeping me calm enough that I'm okay right now. And then I will go back to EMDR this week and process what happened Friday. Oh my gosh, it's just never ending. But fingers crossed.